Hello, my name is Haley Greenlee. I'm an RBT. I currently work at a clinic with children ages 2 through 13 in the Atlanta area. I plan to graduate in July and take the BCBA exam at the end of 2024. I'll be acting as the group's illustrator by providing visual supports.
Hi, my name is Lauren Mason. I have been an autistic support teacher for 9 years in the Philadelphia area and have grown in this field by obtaining my master's degree in special education with a focus in autism. I have recently begun my journey in becoming a BCBA and am in my first semester here at Ball State.
Hi, my name is Caitlin Howman. I am currently working as a lead RBT in early intervention clinic. I've been working as RBT for 4 years and I'm graduating with my master's in ABA in May of this year.
Hi, my name is Anissa Garcia. I'm an RBT and currently work with an ABA clinic providing in-home services and social skills groups to clients ranging from 3 to 24 years old. I have my master's in special education and I've worked in this field for about 6 years. This is my first semester with the BCBA program.
Today, we will be completing an informal debate surrounding the topic of collaborating with other professionals. Within this informal debate, I have the role of summarizer, and I will be speaking to each of the pros and cons. Caitlin is the role of the researcher, and she will be providing more in-depth information for each of the topics. Nisia will be the fielder for this debate and addressing any questions that we may come across. And Haley will be the illustrator and provide each topic with a visual that represents the information. We will discuss the pros and cons that arise when working to collaborate with other professionals, share detailed information regarding each topic, and provide answers to typically asked questions. When working as a BCBA, you are one member of a team of individuals working to support one client and their needs. We will be discussing the importance of collaborating with other professionals as well as the challenges that are faced in doing so. Working together with other professionals allows the opportunity to maximize outcomes for the client, add professional expertise, and ensure the effectiveness of treatment. On the other hand, challenges that are faced are the cost of services, training or lack of training and behavior, and buy-in from other professionals. We will be diving deeper into each area as we move through the debate.
So, what is autism spectrum disorder? ASD is classified as a developmental disability caused by differences in the brain, according to the Centers for Disease Control and Prevention. These differences can affect an individual's speech, motor development, social communication, and learning abilities. Children diagnosed with ASD often struggle with social interactions and engage in challenging, restrictive, or repetitive behaviors. There may also be challenges to learning, moving, and with concentration. Approximately 1 in 36 children in the United States are diagnosed with autism spectrum disorder each year. 30 to 40% are diagnosed and have non-speaking at the time of diagnosis. 30% have a learning disability. Applied behavior analysis, or ABA, is one of the most widely used evidence-based practices to implement interventions aimed toward increasing independence in those with ASD. Individuals diagnosed with autism often benefit from a variety of collaborative healthcare professions and therapies.
Next, I'll talk about what a behavior analyst is, their role in treatment, and their ethics code set forth by the Behavior Analyst Certification Board, or BACB. A behavior analyst or board certified behavior analyst is a professional who helps solve behavior related issues. Behavior analysts evaluate, design, and implement protocols to improve skills. They apply techniques to assist others in developing new behaviors and modifying existing behaviors. Behavior analysts are held to a certain ethical standard upheld by the Behavior Analyst Certification Board, or BACB. The ethical requirements outlined by the BACB provide a foundation and boundaries to be effective supervisors, clinicians, and teachers. It's important to document all actions that have been taken in eventual outcomes when considering the ethical code for behavior analysts. It's important for behavior analysts to be able to collaborate with other professionals in order to create effective treatment for their clients. The BACB 2.10 Collaborating with Colleagues Ethics Guidelines states that behavior analysts collaborate with colleagues from their own and other professionals in the best interest of clients and stakeholders. It's important to address conflict by compromising when possible and always prioritizing the client. Collaboration in ABA is important for client success. Successful collaboration can lead to a positive impact in the treatment process and outcomes for clients. Behavior analysts work alongside other professionals such as occupational therapists, speech language pathologists, teachers, and other similar professionals often. Behavior analysts may run into other collaborating professionals that have varying ideologies, professional ethics, and different approaches to interventions. Despite behavior analysts' constant collaborations with other professionals, they report little to no professional development on how to successfully work with professionals from outside the field of ABA.
When collaborating with other professionals, there are pros to consider. One thing to consider is how the team can work together to achieve the best outcome for the individual. Each team member also has their own scope of competence and areas of expertise. And lastly, team members can use their own data collection methods and to determine how effective the treatment was.
So let's dive into our debate by discussing our first topic, maximizing outcomes versus the cost. Working with those identified with disabilities, especially those with autism, requires collaborative support from all members on the team, which leads us to our first advantage of collaborating with other professionals to maximize the client's outcomes. Bowman 2021 explains that collaboration between professionals can be viewed in 3 different ways. Multidisciplinary team collaboration allows professionals to maintain boundaries, meaning they work parallel to each other and each focus on their own goals. Interdisciplinary team collaboration combines the professional knowledge and allows the team to share goals and responsibilities. Lastly, transdisciplinary team collaboration allows professionals to maintain their boundaries while also collaborating frequently to continue to expand their knowledge in other areas and share their ideas. There are many different means of collaboration, but by understanding everyone's roles on the team, it allows professionals to work together for the best outcomes for their clients. When collaboration exists, professionals on a team can focus on common goals, solving problems, and building their knowledge.
Research shows that collaboration between BCBAs and related service providers can improve educational outcomes and increase treatment fidelity. When BCBAs have the opportunity to collaborate and work as a team to collaborate on client goals and understand each professional's strengths that can be brought to the interdisciplinary team, the client has the opportunity to receive well-rounded services to meet their needs.
Even with great team collaboration to provide clients with maximized outcomes, one of the disadvantages of utilizing an enhanced team approach is that many families struggle to get services or maintain services due to the cost. Many families have and utilize health insurance to support ABA services, but the entire cost is not always covered. According to the CDC, services for children with autism can cost anywhere from an additional $17,000 to $21,000 per year compared to a typically developing child. Those diagnosed with disabilities require additional medical appointments, therapies such as ABA, speech, occupational therapy, and other additional care. For families that are not able to utilize the support of health insurance, this cost limits their ability to have these services, which are beneficial.
As Lauren had stated, those diagnosed with ASD are more likely to have higher medical costs than their counterparts with ASD. Studies show that patients with ASD have a higher rate of utilization of both acute care and specialty care than their counterparts. Creon and colleagues found that children with ASD experience a higher percentage of inpatient 3% versus 1% and outpatient hospitalization 5% versus 2% than children without ASD. In a study by Wang, the highest percentage of healthcare expenditures was devoted to behavioral therapies at 5.3%. The study was conducted in the United States. Another study by Gaines also estimated that the behavioral therapies were the largest part of lifetime medical expenditures, reaching peak at 3 to 7 years of age. Overall, rehabilitation services, ABA, occupational therapy, speech therapy, etc., comprise the largest component of annual ASD direct medical costs at 70%, according to a study conducted by Mazzodegrade.
This figure projects the future growth of costs for caring for those with ASD estimated by economists. These costs could reach $1 trillion by 2025 and include medical, non-medical, and productivity loss costs. The researchers for this article stress that early intervention and the diagnoses are key to keeping costs down and promoting independence among those with ASD into adulthood. Leonard Abudueto, director of the UC Davis Mind Institute, stresses that school-based interventions should be adequately funded to ensure better post-secondary and vocational options for adults with autism, and will ultimately reduce the cost to society. On this slide, a visual showing common comorbidities and their prevalence among those who also have an autism diagnosis. These comorbidity diagnoses may require multiple specialists for both behavioral and pharmacological treatments for disorders such as epilepsy, for example, which is beyond the scope of practice for a BCBA. This visual shows the necessity for collaboration among multiple practitioners for the best outcomes.
So some questions we considered are, what is the difference between the collaboration teams? First, an interdisciplinary team is a group of professionals who work in collaboration together. This means that they work together to ensure the services or interventions being provided complement each other for their client's needs. An example of this is if the client's special education teacher uses the interventions that are used during ABA in class. For example, a visual schedule or the same prompting hierarchy. A transdisciplinary team also works in collaboration with a common goal to provide the best service available to the client. In a transdisciplinary team, they will discuss how to provide services for the client, but not implement the same interventions. They will exchange ideas from the viewpoint of their discipline. An example of this is if the ABA team shares how they handle maladaptive behaviors, but the speech team may not implement the same interventions to handle those same behaviors. The next question is, who can be part of these teams? The collaboration team is a multidisciplinary team that is working with the same client. This can include speech pathologists, occupational therapists, physical therapists, special education teachers, general education teachers, and the client's ABA team. The client's family and the client themselves are also a part of this team.
Our second topic revolves around utilizing each team member's professional expertise. But what about the training barriers that arise? When working with a client, an advantage of collaboration means the members of the team each have their own professional expertise to offer. Within this scope of competence, collaborating with other professionals allows the opportunity for conversations that builds a level of understanding across the different professions. Specifically, referring to the growing number of those diagnosed with autism, utilizing every member of the team allows for a wider scope of support for that client. Members of the team are able to provide their own expertise based on their specific area, but also collaborate in other areas as needed to offer any insight when problems may arise.
Alternative theories and different philosophies can make a team more effective and more successful in developing comprehensive treatment. Professionals from all disciplines need to understand their scope of practice and training other professionals have to understand where their expertise might be most relevant for treatment.
This figure, created by Bowman and colleagues for their 2021 paper, Standards for Interprofessional Collaboration in the Treatment of Individuals with Autism, compares the three types of collaborative teams by relating them to food. The multidisciplinary team on the more autonomous end of the spectrum is comparative to a salad where the ingredients are mixed but left relatively unchanged. This would include minimal communication between disciplines and professionals working primarily on their own. Interdisciplinary teams are more closely compared to a soup where practitioners coordinate and share tasks and goals, but discipline roles are maintained. Transdisciplinary teams are more relative to ingredients baked in a cake, where roles are released and expanded and expertise is integrated into a unified treatment plan.
Professional expertise is important, but what happens when providing the proper support to clients gets challenging when not every staff member on the team is trained to implement the necessary strategies? Staff training is a barrier that impacts the ability to implement plans and behavioral strategies with fidelity. Many professionals, such as general education teachers or paraprofessionals, lack the training needed to support students with a variety of needs, but more prevalently, those diagnosed with autism. According to a study conducted by Mohammed Jafal, the findings showed that general education teachers lack training in how to work with students with autism spectrum disorder in their general education classrooms, lack collaboration opportunities with their special education colleagues to better support their students with autism, and are not provided sufficient resources by their schools and programs to create an appropriate, inclusive environment in their gen ed classrooms. Unfortunately, overcoming this barrier can be challenging as access to training creates costs as well as the time needed to complete the trainings.
In 2015, Reed and Henley mentioned that it costs roughly $137 billion annually to deliver services to individuals with autism, and this number has gone up every year. Providing effective staff training and performance management is an ethical obligation for the BACB and is necessary in delivery of evidence-based practice. When staff receive poor training and insufficient performance management, this can lead to compromised staff, consumer interaction, opportunities for teaching, and consumer quality of life.
So a question that we came across in this section is, are ABA professionals allowed in the classroom to work with the aide? Ultimately, it is up to the discretion of the school district whether or not they will allow an outside ABA team inside of the school site or the school system. However, research done in 2001 by Dunlap et al. Has shown that ABA has provided important contributions to the classroom. These contributions include things like creating curriculum-based assessments and training aides and teachers on behavior interventions.
Our last topic encompasses the effectiveness that treatments have to offer clients, but the buy-in from caregivers and other professionals can get in the way. There are many different approaches in providing clients with the proper treatments involving specific IEP plans, related services, positive behavior support plans, and ABA therapy, just to name a few. Currently, in supporting clients with autism, ABA therapy is a prevalent treatment that requires fluid implementation to ensure success. Applied behavior analysis allows for individualized support and interventions. This approach allows for the members on the team to implement a cohesive approach to interventions and ensure success through analysis of data collection. This analysis allows frequent opportunities to determine a client's progress, further needs, and to make adjustments to plans or interventions as needed. Currently, there are many research studies that demonstrate the success of utilizing ABA therapy and the effectiveness of this treatment approach.
Within the behavior analyst in practical practice journal, Walsh mentions that children with autism deserve ABA because there's more scientific evidence demonstrating ABA works than there is for other intervention of treatment. 40 to 50% of individuals diagnosed with ASD can learn enough to return to mainstream classroom if they receive high quality, intense, evidence-based early intervention.
Even with ABA therapy being noted as a successful strategy based on many studies, a disadvantage that arises is that there are many people that believe that ABA therapy is not a suitable method. Autism and neurodiversity activists deem ABA therapy as abuse based on prior studies that have taken place, such as the Ivar Lovis and the UCLA Young Autism Project, as well as the use of punishment and extinction-based procedures, diminishing stereotypic behaviors, the goals of therapy, and the concern that this abuse leads to negative outcomes related to mental health. The concerns regarding the Young Autism Project are the use of shock therapy to address self-injurious behaviors, intervention hours up to 40 hours a week, and the ABA therapy being provided was based on a one-size-fits-all idea. There are many valid concerns involving ABA therapy based on the past history, but there are also many misconceptions as well.
Despite an abundance of evidence in ABA interventions, there are still some individuals who express concerns with the use of ABA. The BACB Ethics Code was created to help behavior analysts approach complex situations with good judgment and protect patients who seek care.
So some questions to consider is, does ABA use shock therapy? Although shock therapy has been used within the history of ABA, there is no current research that shows that it is commonly used as an ABA intervention for autistic individuals. While there may be examples of shock therapy that was used, as in the UCLA Youth Autism Program, it is an exception and not a rule. Is ABA one size fits all? Historically, ABA may have been considered one size fits all because there was a lack of research on what ABA is and how effective it can be. ABA is often individualized for the client, and the day-to-day of what it looks like is ever changing depending on what is happening. Although different ABA companies may use the same procedures or implement similar interventions, the implementation of the intervention is dependent on the skill of the clinician and ultimately how the client would react to intervention.
From this debate, you can see that there are many different advantages and disadvantages to collaborating with other professionals. Based on the research provided, we believe that the advantages of collaborating with other professionals greatly outweighs the disadvantages. The job of the BCBA is to benefit others, treat others with compassion, dignity, and respect, behave with integrity, and ensure their competence. All of these core principles can be met when collaborating with other professionals, but more importantly, this collaboration leads to the best interest of the client. Through collaboration, we can maximize outcomes, provide our professional expertise, and maintain the effectiveness of the treatment plan. As we discussed, some factors that may get in the way are the cost, training barriers, and buy-in from other caregivers and professionals, but these factors do not outweigh the importance of team collaboration.
So through this debate, we have some additional questions that we can answer. So what can a BCBA do if the other professional has low fidelity in their data? If a BCBA believes that the collaborative data is not truthful or has low fidelity, then they should meet with the collaboration team to determine the cause and figure out an end goal. To maintain the collaborative relationship, the BCBA should trust that the other professionals will operate in the best interest of the client. However, if they believe that the non-behavioral colleague would interfere with the client's long-term success, then they should raise concern and discuss different options for that client. How can the BCBA maintain collaborative relationships? BCBAs can maintain and strengthen collaborative relationships by following the ethical code created for them. As BCBAs, we should prioritize the partnerships and ensure that we have an open mind to opinions from other professionals. Why is collaboration important? Collaboration can lead to long-term success for clients and their families. By collaborating with other professionals, we are able to provide clients with the most effective treatment plan for them. What is a BCBA's ethical role in collaboration? BCBAs have an ethical responsibility to the client and their stakeholders to ensure that effective treatment is provided. They are also ethically bound to stay within their scope of competence, meaning that they cannot provide opinions from a speech language pathologist or an occupational therapist aspect because a BCBA is not a speech language pathologist or an occupational therapist. How can BCBAs collaborate with professionals who don't follow behavioral intervention? If a BCBA is put in a position where they have to collaborate with another non-behavioral professional, as in an OT, physical therapist, or speech language pathologist, then the BCBA can do a few things. First, the BCBA should try and find more information about any intervention that the other professional has suggested. This can be things like wearing a weighted vest or changing the client's diets. Borehead also suggested a decision-making model that assists in helping the BCBA solve all or any ethical dilemmas that occur when collaborating with non-behavioral professionals. The model asks a few questions. Is the client's safety at risk? Is the BCBA familiar with the treatment? And will the treatment negatively impact the client's goals? In answering these questions, the BCBA can make an educated decision on what would be the best course of action when collaborating with another professional. What ethical codes should the BCBA follow when collaborating with other professionals? As BCBAs, we should be following the ethics code in all that we do, but when collaborating with other professionals, there are some that we think are important to take note. Ethical Code 1.01, being truthful. Ethical Code 1.03, taking accountability. 1.04, practicing within a defined role. 2.05, practicing within a scope of competence. 2.08, communicating about services. 2.10, collaborating with colleagues. 3.01, responsibility to clients. And 3.06, consulting with other providers. Per Ethical Code 2.10, BCBA should be collaborating with professional colleagues as long as it is in the best interest of their client.